Well, good afternoon. We're gathered here today on Treaty 6 territory, and I recognize the Métis people of Alberta who share a deep connection with this land. The UCP's plan to expand surgical privatization will do lasting harm to Alberta's public health care system and ultimately lead to more out-of-pocket costs for Albertans. Expanding for-profit care takes staff and resources away from the public system, which is already experiencing widespread and severe staffing shortages, thanks to Danielle Smith and the UCP. Operating rooms in hospitals, that is, facilities we already have been sitting empty for extended periods of time because Danielle Smith and the UCP have and continue to drive healthcare workers out of the province and out of their professions. In the fall, we shared an internal presentation from AHS about the Alberta Surgical Initiative that shows public capacity is being greatly underutilized due to the UCP's incompetent and chaotic management of our healthcare system. The UCP's failed plan is based off the same idea in Saskatchewan, which also failed. Wait times there are longer than when their privatization scheme first began. It's clear, private companies exist to make a profit. And every healthcare dollar that goes to companies' profit margin is a dollar that is taken out of the public system. Sooner or later, in private facilities, those dollars also start coming out of patients' pockets. The UCP has to be upfront about the possibility for patients to be upsold or pressured to pay out of pocket for different services and products. The UCP has not offered one reason why increased capacity cannot be built within the public system. The minister talked today about how surgery-specific facilities can increase efficiency of surgeries, which is true. But that can still be done within the public system. So unlike the UCP, an NDP government will focus on expanding our public system. We will bring real resources to the front line, work collaboratively with healthcare professionals, and we will end the UCP's chaos in our hospitals. Thank you, and I'm happy to take any questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Please state your name and outlet before you ask your question, and we'll start in the room here.
Sure. So Catherine Grakowski, Alberta Today. So the minister says, no, this is not about stealing resources from the public to these facilities, and that there's actually surgeons sitting around waiting to be, and they want to do surgeries, but there's not the OR capacity. Can you explain how you think that the resources are being diverted from the public system?
So the minister is correct at one point. There are surgeons who have more time that could be doing more surgeries. That is without question. However, we have OR capacity within our public facilities where those surgeons could be operating. They're not operating there because we don't have the other support staff. We lack anesthesiologists, which this government has driven out of the province. I've talked with surgeons at the Red Deer Regional Hospital and other facilities across this province where they have lost anesthesiologists because of this government's attacks on physicians in the province of Alberta. So the problem here is not OR space, private or public. The problem with capacity right now is we do not have enough healthcare workers. And by opening more private surgical facilities where they will get to cherry pick the simplest, easiest cases, you're creating an environment where you are going to draw OR nurses, anesthesiologists out of the public system where this government has created incredible chaos, frankly, in many ways made it a miserable place for people to work. So then we have an outflow of folks from the public system where we already have a severe staffing shortage into private facilities where every public dollar that goes helps then pad the pockets of a corporate shareholder instead of all those dollars being invested in care. So that is our concern.
Yeah, and you mentioned upselling. Have you heard any stories from patients thus far about that their experiences in these facilities where they're being told, hey, you can pay for this better service, or being told to pay out of pocket?
Yes, absolutely. I've heard from individual Albertans, and indeed just this past weekend I saw a Twitter thread from Charles Rusnell, the investigative reporter, independent here in the province of Alberta, speaking of his own experience, where when he went for eye surgery, He was told that if he got the upgraded lens, I believe it was, that his surgery would be able to be done faster than if he waited and simply went with the conventional lens. So this is part of the problem, is that these private facilities are incented to look for ways that they can make more money. And one of those is, well, hey, if you can upsell people, I mean, I know how upselling works. I worked in a restaurant. And I mean, it's one thing to see if somebody wants to get a double instead of a single on their cocktail. It's a whole other thing when we were talking about people's health care, which is a protected service and right for Canadians, for Albertans. We should not be creating environments where people have to face a high-pressure salesperson when they are looking simply to get the public health service that they deserve.
Thank you. We'll go on the phones now. Caller, your line is open. Please state your name and outlet.
Mr. Shepherd, I'm just wondering if you can comment a little bit about the capacity, in the increased capacity of this initiative on rural hospitals, whether it's Edson, Rocky Mountain House, Grand Prairie, Lethbridge, Medicine Hat. Is that a good thing? And if not, what do you think the overall kind of impact might be to rural healthcare from this initiative?
So I'd say the principle that when we are looking to expand surgical capacity, we would look to our public facilities and look how we can best utilize them. I 100% support that. That is a good principle and that is a good practice. Now, the challenge here, of course, is that we have seen our rural health facilities decimated over the last 3 years under this UCP government because of their politicization of the pandemic, their choice to continually put politics ahead of public health. They have created a situation where we have multiple facilities across this province that cannot provide the most basic services, where rural emergency rooms that are closed overnight, obstetric services that have been canceled for months because of the decisions of this government, which have driven healthcare professionals out of their profession and out of the province. So certainly I think it is not an unreasonable goal, in fact maybe a good thing to look at how we can better utilize our rural capacity in terms of operating rooms, but we are going to face the crunch of that severe staffing shortage which this government has made so much worse.
Just on that, just as a follow-up, I mean, it's an election year, what's your pitch to rural residents of Alberta on what the NDP would do for healthcare in outside of the larger cities?
So a couple of things. First of all, we would look to end the chaos that we currently have in our system, create stability, and start to work collaboratively again with frontline healthcare workers. I'll be honest with you, I've spoken to a lot of rural healthcare providers over the last 3 years. Probably at times maybe more outside of the major centers than I have within, because so many of the decisions that were made by this government, including their war on physicians, had the most significant impact for rural facilities and rural areas. And those physicians spoke out early on. When this government announced its plans back in the fall of 2019, early 2020, those rural physicians reached out to me to warn that we were going to end up where we are today. So what we really need is a government that's going to sit down and work collaboratively with those healthcare workers, and we are going to invest to get those services back up and running. We are going to launch the most comprehensive, significant recruitment campaign this province has ever seen to bring healthcare workers into this province to work in all facilities, including in rural Alberta. That's why we made the commitment last week that an Alberta NDP government will fully fund, fully support, and look for every possible opportunity to accelerate the expansion of the Red Deer Regional Hospital, which serves so much of central Alberta and takes pressure off of some of those rural healthcare sites and certainly supports their work. That's why we have commitments around EMS and other services that we are going to work with frontline paramedics to ease the pressure, to ensure that that ambulances can stay in their communities and be able to support. We will work collaboratively with rural municipalities, healthcare workers, and facilities to end the chaos.
Thank you. We'll go to our next caller. Your line is open. Sorry, we missed that. Oh, okay, go ahead.
Yeah, Jason here in Calgary Herald. David, just wondering if you had any reaction to the situation ongoing now with the outage on the Alberta Health Services internal network and Connect Care and some of the problems that caused it this morning.
Absolutely. I was obviously concerned to hear about that this morning. We want to be sure that Albertans can access the services they need when and where they need it, and certainly the infrastructure system of internet and other digital pieces are essential to providing that. So it's my understanding that AHS IT teams are working to address that now, and I'm certainly hoping that they're able to do so soon so we can get things back up and running. But the other thought that occurred to me is, as I have said and will continue to say, this government has created such chaos in our healthcare system, and I know that healthcare workers have already been pushed to their limits. They're facing severe staffing shortages, and they're under incredible pressure, and unfortunately, this will just add to that. So I want to say a big thank you to all of the frontline healthcare workers who are stepping up into the breach to make sure that we continue to provide services as best we can in the midst of this, and it's certainly my hope that the AHS IT team is able to resolve this as quickly as possible.
Do you have a follow-up?
That's it. Thanks, David.
Thank you. We'll go to our next caller. Your line is open.
Hi, it's Megan Cobb from Global News. Just, excuse me, just building on that. We've heard everything from this outage that some services are moderately affected to that entire systems are down and, you know, emergency departments are having to use pen and paper. Do you have any idea of how severe the outage actually is and what those impacts are?
Unfortunately, I don't have anything beyond the information that's already out in public, what people are sharing on social media. I've been in meetings myself this morning and haven't had the opportunity to reach out to folks on the front lines, and indeed, I imagine anyone on the front lines is probably busy trying to deal with the situation and wouldn't really have the time to provide me with an update. So at this time, it's just certainly my hope that we can get these systems back up and running as quickly as possible. I know our frontline healthcare workers are going to do the best they can under the circumstances, and it's just my hope that we see this resolved quickly.
Do you have a follow-up, Megan?
Nope.
Thank you. We'll go to our next caller. Your line is open. Paula, your line is open.
Hi, can you hear me?
Yes.
Okay, sorry, there's a bit of a technical difficulties there, but I have a bit of an off-topic question. I was wondering if you had anything to say about the Preston Manning panel, given the fact that his, I guess, fictional report has come to light on the COVID-19.
It's quite clear, you know, in light of what's come to light, what Preston Manning has said, what he has written, that this is nothing more than a political exercise on the behalf of Daniel Smith and the UCP. There is no chance that what we would see here would in any way be an unbiased report that would have any value for Albertans. Frankly, there are many, many better ways we could be spending $250,000 than paying Preston Manning to rewrite his apocalyptic populist fan fiction. We could be supporting our frontline healthcare workers. We could be directing those dollars to the millions of Albertans who are left out of this government's affordability plan, including hundreds of students living here in my constituency. What we have here is clearly Danielle Smith making a play to try to satisfy the far-right base that propelled her into the premier's seat. After multiple embarrassments, as she has gone on the record about talking about influencing or attempting to influence prosecutors, the email scandal in her office, this is nothing more than a distraction and a waste of taxpayer dollars that could be far better spent and invested.
Do you have another question, Paula?
Nope, that's all for me. Thank you.
Thank you. We'll just do one more pass for questions.
Question. Is it kind of coincidental that Ontario announced this last week? Alberta is doing this week. Is it too coincidental, or is there, is there something going on? Just your thoughts on that. Like, there's the two conservative provinces within a week are announcing similar things.
Let's be clear, there is nothing new about the Alberta Surgical Initiative, which is based on the Saskatchewan Surgical Initiative, which is based on a long-standing phantom narrative amongst Conservatives that private providers are better equipped to provide public health care services than the public health care system. We see, unfortunately, from folks in the Conservative realm, like the former Premier Jason Kenney, before he became Premier, when he was campaigning in the 2019 election, frankly, a level of contempt towards public health care workers in the public health care system, insisting that they are lazy, entitled, that they simply don't step up and innovate, that they don't find the best efficiencies. The fact is, as I have said, there is nothing about this particular model that works better simply because part of the dollars paying for it goes into the pocket of a corporate shareholder than simply if those dollars are invested in the same system, same infrastructure, same methodology within the public system. But what we have, unfortunately, is Conservative governments in Canada continually pursuing ways to try to get more dollars into the pockets of their friends who want to run private healthcare companies to provide public services. It's not in the best interest of Albertans. Frankly, it's not in the best interest of the people of Ontario. And as we've seen, it was not in the best interest of the people of Saskatchewan. And an Alberta NDP government will put a stop to those kinds of investments. We will invest in the public system.
Just your answer about the threat on Charles Rusnell tweaked another question. So under the contracts, these facilities are allowed to upsell, but what they're not allowed to do is do it in exchange for faster service. Is what we have here queue jumping? Does there need to be an investigation on those allegations?
Certainly, if the sort of situation that Mr. Rusnell described indeed is occurring, then absolutely. I think that's something that should be examined. That's something that should be investigated, and it's something that should be stopped. So certainly we have a certain number of facilities that are already offering these services. Certainly I would be interested to hear a bit more about how that operates, and that is perhaps something that should be considered and looked into. But ultimately, what we should be doing is investing those dollars in our public healthcare system where we simply know that does not take place. There are things we can do to improve that, as I think, as Charles referenced. Centralization of how we are booking and triaging and setting up that system of priority for surgeries would be one way to do that, far more efficient, and eliminates the possibility for that kind of manipulation by a private provider.
Okay, we'll do one more pass for calls. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you, everyone.
Thank you so much for watching, and to learn more, check out albertasfuture.ca.